If you're an American citizen, you've been to a hospital in the last few years, very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits paid for by American citizens?
Well, JD Vance, I'm glad you asked. So let's give you a little history lesson on why we don't check people's papers at the emergency room door. And it's all because of Ronald Reagan. Reagan signed the Emergency Medical Treatment and Labor Act into law back in 1986. It was part of bigger legislation that passed overwhelmingly bipartisan support, and it included some pretty popular provisions even today, like those COBRA protections that keep you from losing your health insurance if you get fired or you lose your job. And this was legislation that was co-sponsored by Republican Bob Dole, who said we needed it for a few reasons. The first was to prevent hospitals from patient dumping. That's where they refuse service because of somebody's inability to pay. Also, Dole said that we had a moral duty to make sure we provided life-saving care for people in emergency situations at, emergency rooms. Also, checking somebody's wallet for an insurance card or a credit card or a birth certificate, or making sure you know which language they speak, not always easy to do when they're in an emergency. So Vance also asked why those costs are paid for by American citizens, except they're not directly. Hospitals actually foot the bill, and the undocumented costs are a fraction of the total unpaid emergency room bills for American citizens who either don't have the money or the insurance to pay for everything. Now, those costs might indirectly get passed along to consumers, but the same thing happens with tariffs, and Vance doesn't really see those costs as an issue. And this estimated cost for hospitals of undocumented immigrants' unpaid bills in emergency rooms is about $4 billion a year, which I know is not a drop in the bucket, but it pales in comparison to the $100 billion a year that undocumented immigrants pay in federal taxes, the benefits of which they are largely ineligible for. So long story short, if JD Vance wants to know why somebody can go to the emergency room who, as he said it, can't speak English, then he can thank Ronald Reagan.